conducting the survey along with YouGov. Morning to you. This is pretty disturbing. Why are people really leaving in such numbers?
Well, our studies suggesting, the YouGov study, is that a lot of this is obviously down to cost of living, as you was already saying. People are finding it very hard to live on the average wage that they're getting within the social care. But it's also it's a workforce issue. So we have a lot of people are leaving because simply they can't take the work that they've got because they aren't able to provide the type of care that they joined the social care sector to provide. So a lot of it is all around recruitment and retention of staff, and a lot of that, I'm afraid to say, comes down to how much we're paying them.
Issue of recruitment. Our previous guest was saying that the government's been incredibly successful post-Brexit in attracting international nurses and doctors to the UK and to the NHS. Is that not happening in the care sector?
Well, I think there's such a huge demand in the care sector. I mean, I think the NHS has got 136,000 vacancies. It's a huge amount of vacancies, just the NHS. Social care sector has got that as well. I think 84% of care home establishments that we spoke to have a recruitment crisis. So we can recruit from abroad if it's an ethical way. Of course, there are some countries that you wouldn't really want to recruit because you're taking away the intellectual capital and the skills with that country. But there are countries you can, and it can be effective. But this is something that we're not going to be able to plug long term by just recruiting people from abroad. We can do something short term, and in fact we're doing the same, but it's not something that's sustainable. We have to create, grow, train, retain our own staff who want to work within the healthcare sector.
Is part of the problem that this is effectively a private sector?
The problem is throughout public or private sector. I mean, the NHS has got problems, nursing homes have got problems, care establishments have got problems. This is right across the board, not-for-profit organisations. Everyone is in the same position of not being able to retain and attract enough staff. That's generally speaking. We as an organisation are very lucky and fortunate, because there are people who do want to join, but you have to create the right environment, you have to pay them right, training, education, support, mental health support, very, very important, and that's something that we're doing as an organisation. I mean, last week we had over 5,500 applications to join us, so there are people who want to join. Within our survey, 23% of people who were surveyed of working age said they would like to join us. That's 6.4 million people would be interested in joining or entering the healthcare sector. So there is a demand. We need to find the right way of retaining and retention, because we've got a lot of people leaving as well.
Yeah, and look, it's an absolutely fantastic way of easing the pressure on the NHS as well, identified absolutely fundamentally by Boris Johnson, who wanted to increase national insurance to try and sort out the whole sector, arguably derailed by COVID. And now we know, in the last 9 days since that mini-budget, that rise in national insurance has been scrapped by the Truss administration. Are you disappointed by that? And what do you want to hear from the Health Secretary, Therese Coffey, today when she stands up at conference?
The social care sector and the NHS need more money. I know no one likes to keep hearing about that, but it needs more money. It's underfunded. But also, I think there are opportunities to redistribute where the money is being spent. So I think there's some short, medium and long-term options. The short-term option is we've got to deal with the recruitment crisis. We have to pay our staff more, and we have to be able to retain them by providing the right type of training and support. Once we're starting to do that, I think medium and longer term, we need to look at how we're looking after people. We know 1 in 7 beds in the NHS are filled with people who shouldn't be there. That's £5 million a day. It's about 1.6 billion a year. So there are things that we can do to save the NHS and obviously the taxpayers' money by realigning where we're spending that money. And I think, the provision of a home clinic or care at home is something that within our study, we found 84% of people would prefer to be looked after at home. So there's a lot of opportunities where we can maybe move people out of the hospital, and even where procedures where you would normally have procedures in a hospital, you could have those procedures at home with new technology now. The technology is available now. So we could provide a lot of care in the home. So perhaps instead of building hospitals and bricks and mortar, we could actually spend that money on treating people. And I think it's a big turn and it's a big change from an organisation that's, the NHS, of course, looking traditionally have been building hospitals that's the future. But I think the future now is going to be very much at home. I know people are talking about it, but there needs to be real concerted action now to transition over. We know that by 2034, the requirement of social care is going to grow by over 27%. Our ageing population, people over 65, are going to be substantially more than they are today. So we know costs are going up, whether we like it or not. So I think this is an opportunity where we redefine, as a society, what we want from the NHS, what we want from social care moving forward.